Ladies and gentlemen, please welcome to the stage Dr. LaMar Hasbrouck, NACCHO's Executive Director.
Good morning. So I hope you guys had a great first day, and welcome to your NACCHO Annual 2015 for those of you who are joining us today for the first time. So I'm Dr. LaMar Hasbrouck. I am the Executive Director of NACCHO. And so our theme for this year is Envisioning the Future, Creating Our Path. So what does that mean? Well, I suppose that it means different things to different people in slightly different ways. And as with many things, where you stand really depends on where you sit. And as the Executive Director for your professional membership association, I can assure you that that theme has a very real meaning to me. And so I thought I would just take my few minutes this morning and share with you my thoughts on what that theme means and what it means going forward for our association. But before I do that, I think it's important that we take stock of the past accomplishments and recognize those who have been so instrumental in guiding the association to this point that we are today. So since 1994, your association in its current form has been serving members through capacity building, through assistance, through technical support, and through advocacy. It's done so under the thoughtful and strategic leadership of a succession of executive directors, beginning with Nancy Rawding, Grace Grenflow, Thomas Milne, Pat Libby, and my most immediate predecessor, Bobby Pestrunk. And so if success can be defined as a measure of the support that your association has provided for you as members, then based on my review, NACCHO has compiled an extraordinary record of success. Just to name a few successes during the past few years, you've identified, and we poll you often to find out what's on your mind and what you need and where the gaps are, and you've identified funding. Funding always comes up. And so over the past 3 years, we have provided support, either directly or indirectly, to the tune of $25 million in fiscal year 13, $22 million in fiscal year 14, and for the first 11 months of this fiscal year, about $18 million. So I want to put that into context, and I want you to understand that we are not a pass-through association. Your association is not a pass-through association. We do not pass the money through and take some off the top. Every grant dollar that we get goes right back to you, either directly or indirectly, in deliverables and actual action plans and actual initiatives that benefit you as members, and often in partnership with you as members, helping to shape that agenda. You've identified a need for training and workforce development. And just last year, more than 500 hours of one-on-one technical assistance has been provided to you all. There's been 55 travel scholarships to help assist you getting to prep meetings and other conferences. There's been more than 500 of you have actually attended face-to-face workshops, and more than 3,500 have participated in webinars. You asked for assistance with accreditation. We responded. We directly supported 71 local health departments in 30 states to the tune of $2.5 million in technical assistance as each of you all embark on your journey for accreditation as you determine necessary. You asked for a better understanding of this health reform thing and how to adapt to changes and demonstrate your value in this changing context. Well, we developed resources to help you think about how you can best implement ACA locally. We built a public health transformation portfolio. You saw the video yesterday. We have a dedicated web page, and we broadened that portfolio to assist you with that as well. We've also developed on-demand e-learning modules to help magnify your voice in the seat of this change and dealing with how it might impact you locally. So those are just a few things. And how have we done? Well, we survey you, and you consistently and overwhelmingly give us positive ratings in customer service and our responsiveness to your questions and our responsiveness to your needs. But what about the future? So as I was pondering this piece about envisioning the future, I stopped and kind of put myself in your shoes and asked myself, what would I want if I was still a local health official, a local health practitioner? Well, I think I would want a forward-leaning association, one that listened to my concerns, one that continues to respond to my needs, one that supports me in my mission locally. Essentially, I'd want an association that puts me, the member, at the center of every single thing it does. And in following a tradition of excellence, I think I'd want the association to be led by an executive director who knows what it means to work at a local health department. Someone who's familiar with the challenges of managing up to elected local officials and working with a board of health. Someone who knows the pressures of constantly being asked to do more with less until the resources, be it the money or the staff, get to be less and less, where you have to come up and tell your elected official, well, we're going to have to do less with less. I'd want an executive director who has himself or herself faced the dismal prospect of consolidating services, having to be faced with privatizing services, or worse yet, just plain eliminating services. And I'd want an ED who could relate to the extraordinary effort and the finesse often required to navigate the politics, the priorities, the people, the partners or those potential partners, and the policies in the interest of assessing the health needs of their community and mobilizing action through partnerships and planning to protect and improve the lives of the residents within that community. But then I think I'd want something more. I'd want a proven leader who has an additional breadth of expertise in the practice of public health beyond the local context. Someone with a keen understanding of the public health practice at the state level, at the federal level and beyond, and someone with an appreciation of the enterprise of governmental public health, how the pieces fit together, and the irreplaceable value that local governmental public health has within that enterprise. I'd want someone with a robust network that includes public health thought leaders and influencers that could be leveraged to best position NACCHO in a way to maximize its promise and its performance. So my remarks are simple. I want to reassure you that you have that kind of association in NACCHO. And I want to reassure you or assure you that you have in me that kind of leader. These are challenging times, as we all know. Some of you will have to reimagine how you do your work. You may have to reinvent how you do your work. In other words, you're going to have to evolve. So that might deal with changing the composition of your staff or a configuration of your services or looking at a different business model. But your value and your relevance need not diminish. I recently gave a speech during which I referred to this period of time as a public health renaissance, and where I referred to public health as a most splendid profession. And it is. And I say that because it has given so much to me personally. And through this profession, I've gained invaluable knowledge and tools and experiences and relationships that have allowed me to give so much to others through my work. I've had the opportunity to practice public health in many places, and in my 25 years of practice, whether it was in Kingston, Jamaica, or Kingston, New York, Mymensingh, Bangladesh, or in Mutare, Zimbabwe, I've learned one universal truth, and this holds up wherever I go. And that truth is local context matters, and it almost trumps everything. It is the local context that ultimately determines if people in a given community, define it as a zip code or a county or a city, will have a reasonable expectation for health, or alternatively, if they will prematurely die. So as population health leaders, through your work, you're able to bend the arc of wellness for your respective communities. And each of you should be reminded of the difference that you make in the lives of the people that you serve and that you touch every single day through your work. Going forward, we will create our path together, and along the way, we, your professional membership association, NACCHO, will amplify your voices through our Hill visits, through our engagement with partners and funders in the general public, through the Foundation for the Public's Health. We will amplify your work through our stories from the field, our publications, our recognition programs like the one we're going to have tonight. And we will amplify your reality, workforce shortages, infrastructure, and other forces of change by constantly communicating with you and finding out what's out there and what we need to do to help stand you up better. I look forward to working with your board, to working with Dr. Jett, our new president, and to working with all of you. And I want to tell you sincerely that being the executive director for NACCHO is an uncommon privilege, and I am humbled that you have entrusted it to me. Thank you.